I kind of see perhaps there's three elements. You have how you look, how you feel, and what your health is like. Because sometimes you might look, fine or healthy, but you're not healthy. Or sometimes you might have a vision that you look overweight, but you're actually within healthy guidelines. What are your thoughts on body image and, the concept of healthy living with that as a backdrop?
I think we often get so fixated about the idea of if you're slim, you must be healthy. I tell you now that some of my slimmest patients are my least healthy, and some of my bigger patients are the most active and healthy of my patient group. So I think there's a lot of misinformation out there around that. I think that so often, though, that what we need to think about is getting a healthy weight for individuals, and that might be just losing a small amount of weight from where somebody is at the moment. So I think when you think about weight management, it's not about often losing a colossal amount of weight if you're overweight. It's about losing perhaps a smaller amount to start with, 5%, which really gives you health benefits. And then you start that journey of success, and success leads on to other success. You start to feel, okay, I've created this new habit, what's next? And often there's a knock-on effect in all different areas of your life. So it's not just about eating more nutritious food, it's about then attending to your sleep, making time for relationships, and making time to enjoy exercise. I'm lucky that I'm the sort of person that loves exercise. So for me, if I don't exercise, I sort of feel like I'm champing at the bit. But I recognise for a lot of my patients, getting active is one of their biggest barriers because they feel they're time poor and they're exhausted. But often, if they're given little tools to help get the ball rolling, and that might be getting an activity tracker and just starting with counting their steps, for example, then that often leads to a bit of a feedback loop, and then they realise, oh yeah, if I do a bit of this during my lunchtime, guess what, my steps go up and they're on their way. So it's all about recognising that we're all pretty individual. If I could manage people's weight with just a one-size-fits-all program, I'd be very fraudulent. There's no such thing. It's about finding the right thing for you and finding what makes sense to you, what resonates and connects with you in terms of making the first little change to get started on a healthier path.